Talk about the underpinning concepts of health and health education. Medical sociologist Aaron Antonovsky came up with the concept of the river of life. The river of life is developed on an understanding that there are factors that influence health and the sustaining of health rather than the development of disease. This particular approach he has termed as salutogenesis. It's a strength-based approach to improving health versus pathogenesis, which is all about the treatment of disease. In Antonovsky's idea of the river of life, he notes that we at any stage are engaged in this river of life. We are accessing and utilising personal resources, accessing and utilising community and social resources, and we're experiencing barriers and enablers. At any particular time, we can describe our situation based on our interaction with these concepts. Within the river of life, to improve health or health status, we are moving from a position of dis-ease to a position of ease. Now, dis-ease is not disease, as in treatment of disease, but we can think of it like an improvement in health status from a concept of where we are uneasy to a concept where we feel more at ease with our health. Now, our ability to access and utilise the personal resources, the community and social resources, and to work with those barriers and enablers will influence how well we can move from a position of dis-ease towards ease. No matter which context we're in or which situation we are in, no matter our state of health, it can be described as our position within this river of life, within this continuum of disease to ease, by describing how we interact with the resources and barriers and enablers. In order to move towards a position of ease, there are 3 stages within health. The first stage is to define and understand. This is where we typically use the determinants of health to understand why this health status exists. What has caused us to be here? Once we have defined and understood, we can then plan and act. How do we actually encourage or enable people to move towards a position of ease? How do we increase their access to and their utilisation of those resources in the river of life? And then once we have acted, we need to evaluate and reflect. Did our implementation actually improve health? How did we do that? How did we ensure that this improvement in health is sustainable? So the concept of the river of life drives everything we do in health and health education. Whenever we ask you to define and understand, or to plan and act, or to evaluate and reflect, we are asking you to consider the position of yourself or someone else within that river of life, and how do we encourage or enable their movement towards a position of ease.